if we start by looking at the movement of people, the movement of people is allowed because people have to go to work, backwards and forwards to work. But it is curtailed between 2100 hours, which is 9 p.m., and 5 in the morning. In the previous regulations, it was from 2100 hours to 6 in the morning. But because people have to go to work, and we know that people travel early, that's why it has been moved back to 5 in the morning. But we are also aware that there are people who would still need to start even earlier, and some people who may finish later. So those people who would have to travel during the curfew would need a permit from their employers that stipulates that they are permitted to travel during the curfew time. And to make it easy, we have gazetted Form 7 on the Gazette, which is easy to fill for those who want to use it as a permit for the workers, for their workers. But of course, it has to be signed by a responsible person in the institution. The second issue is about gatherings. You would recall that in the previous regulation, it said that the gatherings, all social gatherings were prohibited. Social gatherings, but also other gatherings like gatherings of political events or political meetings, gatherings of traditional councils, gatherings, religious gatherings or faith-based gatherings. Any gathering that brings people together is not allowed, except for the ones that are that were in the regulations, like restaurants, gyms, libraries, and so on, which are allowed to operate from the morning to the evening. But everyone is supposed to observe the curfew. Now, the reason that we are continuing with these gatherings, prohibiting these gatherings, is that the pandemic, the infections are continuing to rise. We're now beginning to see a sharp rise in Gauteng as people move back to work or move back to their homes from the holidays. We are seeing a sharp rise, not only in the infections, but also in hospitalization and in the number of people who are losing their lives. Hospitals, especially in provinces like KZN, are really under stress and strain, and in Gauteng it's the same. Even in the others, in the other provinces like Eastern Cape and Western Cape, the numbers are still high, even though they are not rising as they were, but the level is still high. And so that's why we are restricting and prohibiting these gatherings. It's to balance saving lives and saving livelihoods, because people are still going to work, because we have to also save their livelihoods. The gathering that is allowed is a funeral. Funerals are still allowed, but in a restricted form. It has to be 50 people at the funeral, sitting at 1.5 meters apart, wearing masks all the time, sanitizing. The night vigils are not allowed. the after funeral gatherings, like including after tears, are not allowed. Gatherings at beaches and around rivers where people want to picnic and all those places are also prohibited. And so you can, for now, you cannot swim in the sea. You cannot be gathering around the beach. So those are still not allowed, including around public parks that have no access control. Sports fields are also not allowed. So all those gatherings are still prohibited. Sporting events that are recognized by the sporting bodies are allowed, but without spectators. They are allowed, but without spectators. There are also some new regulations. The one new regulation is the one about the banks. It came to our attention that people, especially during the festive season, but even now, queue at ATMs, but there is no sanitization there. So the regulation now is that every bank or financial institution that has an ATM must ensure that there are sanitizers at the ATM. So that is very important, because if not, the ATMs could become super spreaders, because if one person has got COVID and leaves it on the machine and the others start queuing there and using the machine, then that's a problem. The wearing of masks is still compulsory. The only people who are excluded from wearing masks are children below the age of 6, because WHO does not recommend the wearing of masks for those children. But everybody else is expected to wear a mask in public, in every public building, at work, so as to protect not only yourself, but to protect other people as well. The game parks are open from 6 to 6 in the morning. And of course, where people can go, like gyms, restaurants, and so on, only 50 people indoors are allowed at 1.5 meters apart. If it's an outdoor, 100 people are allowed, but at 1.5 meters apart. If the building is too small to carry 50 people 1.5 meters apart, then only half the capacity of that building should be filled. Then the other new regulation is about the land borders. There's been a lot of problems at the land borders as people come back from holidays, from wherever they've been. And it has necessitated that we do close the 20 borders that were open and permit limited services at those borders. I will not go into detail because Minister Motsoaledi is here. He will go into detail about what those limited services are. When it comes to initiation is prohibited across the country. But as I said last week, there were some people who were already in the initiation school. Those should complete. I think by now most of them have completed. Probably by next week they will all be done. And no new initiates should go to initiation school. But those who are coming out of the initiation school, imikiti and any type of celebration is not allowed, because those will become super spreaders. And there is the issue of alcohol or liquor. Liquor is still prohibited in terms of buying, dispensing, distributing, and transportation of liquor is not permitted, both for on-sale or on-site consumption and off-site consumption. No liquor is supposed to be sold, dispensed, distributed, or transported across the length and breadth of our country. At work, there should be compliance officers, as it has been all along, and all the health protocols should be kept. And of course, there will be penalties for those who do not keep to the rules. And the penalties can range from a fine to imprisonment for not more than 6 months, or both. But I also want to stress that the government does not want to arrest people, doesn't want people to be fined, doesn't want people to be imprisoned. It just wants to make sure that we protect one another. You protect other people by keeping to the rules, and you protect yourself, your family. So we will just plead with you to keep to the rules so that you shouldn't have any brush with the police. In the non-hotspot areas, the beaches are open, but the only non-hotspot province that has a beach is the Northern Cape. So it's only in the Northern Cape where they are allowed. Now, all these will be obviously only be reviewed when we are past the peak, as the president said, and when the numbers have declined sufficiently not to take us to another wave. So just to conclude, the other regulations that were in level 1 are there, like the rental issues, the demolition of houses, the eviction. Those are still there. I won't bother. They've been there ever since. So just to recap, things that are prohibited are night vigils before funerals, after tears and other gatherings after funerals, only 50 people at the funeral, 1.5 meters apart. And the funeral service should not take more than 2 hours. Nightclubs, bars, taverns, ship-ins, and similar establishments are still prohibited. They are closed. Social gatherings, political gatherings, traditional council meetings, faith-based gatherings are still prohibited. Sale, dispensing, distribution, and transportation of liquor is prohibited. Beaches, dams, rivers, lakes in areas declared as hotspots are closed. Public parks, including public and recreational facilities, are closed, except those where there is controlled access. Public swimming pools, except as provided for Regulation 39, are prohibited. All land borders, except for limited services, but that Minister Motsoaledi will deal with in detail. Initiation practices and imigidi are prohibited. Passenger ships for international leisure purposes are prohibited, excluding small crafts in line with health and border law enforcement. Attendance of any sporting event by spectators is prohibited. Njengoba besishilo, siyacela ukuthi silandele imithetho le obekukhulunywe ngayo. Izinto ezingavumelekile zingenziwa. So qala nje ngokuthi ebusuku kufuneka ukuhamba kuphele ngo-9 ebusuku kuze kuqalwe ngo-5. Kodwa makufuneka uye emsebenzini noma ubuye emsebenzini uzovunyelwa uma ngabe umqashi ekunikezile imvume uyiphethe yokuthi ukwazi ukuhamba ngaleso sikhathi. Kwesibili, imingcwabo ayivumelekile ukuthi ibe ngabantu abangaphezulu kwama-50. Imlindelo ayivumelekile. Lokho kuthiwa angazi kuthiwa ngesizulu lento kuthiwa after tears. Ngoba ngakhula ingekho mina lento kuthiwa after tears. Kwakuthi maqedwe umngcwabo abantu bagoduke. Nayo ke ayivumelekile. Siyacela futhi ukuthi imingcwabo inkonzo yomngcwabo ingathathi isikhathi esingaba phezulu kwama-hour 2. Kufuneka nje kube ama-hour 2 iphele inkonzo. Futhi abantu mabeza kufuneka ba-sanitize, bageze izandla, bafaka ama-mask ngaso sonke isikhathi, ifonyo ngaso sonke isikhathi. Kungabi khona isikhathi la kuzothiwa kuyaculwa emngcwabeni abantu abasawazifakile ifonyo. Ngoba leso sikhathi lapho abantu bethelelana khona kakhulu. Enye into engavumelekile ukuyolwandle uyoncebeleka noma emifuleni noma kuphi akuvumelekile. Kuyo yonke indawo lapho leli gciwane noma lolu khuvethe luphambili. Lezo ndawo izona zonke empeleni ngaphandle kwase-Northern Cape. E-Northern Cape bona basangaya olwandle bayoncebeleka ngoba izibalo zabo zincane azikayi phezulu. Kodwa noma beya nabo kufuneka bayigcine imithetho. Ukuhlangana-ke nje, ukuhlangana noma imishado noma imicimbi noma yini ehlanganisa abantu ngaphandle komngcwabo ayidingekile, ayivumelekile. Ukuya emasontweni nasey'nkonzweni nasemamos namasinagoge nakumathempele zonke lezo ndawo akavumeleki ukuthi kuyohlanganwa kuhlanganyele inkonzo. Kodwa uma ngabe umuntu efuna ukubona umfundisi wakhe yedwa noma bebabili kukhona inkinga abanayo bangambona umfundisi, kodwa ukuhlangana akuvumelekile. Umfundisi-ke vele uyaya makushoniwe ayoduduza noma ayobasiza, lokho kuvumelekile, kodwa ukuhlangana okungavumelekile. Nabezepolitiki abadingekile ukuthi benze imihlangano. Nasey'ndaweni zamakhosi, imihlangano ey'nkantolo zamakhosi ayikadingeki. Abantu bangaya-ke ema-restaurant bayodla, kodwa nakhona kunemithetho yezempilo okufanele bayigcine. Akufuneki futhi babe ngaphezu kwama-50. Uma bekwazi ukuhlala iqanti nohafu bahlukane. Nakhona uma bengasadli sebeqedile ukudla, isifonyo kufuneka sibuye sibe khona. Nazo zonke-ke iy'ndawo ezinye ezivunyelwe njengokuyojima, njengokuya ema-library, zonke lezo ndawo bangaya, kodwa kufuneka bagcine imithetho. Ukodlala kuvunyelekwe le midlalo evunyelwe yinhlangano lezi zemidlalo, kodwa ababukeli abadingekile okwamanje. Asikho nje isidingo sokuthi uthi uzoyobukela umdlalo. Emagrawundini lawa ethu nje lasivele sihlangane, kusuka abantu bangene egrawundini badlale bese siyaqoqana thina siyobuka, akuvumelekile. Nala kubhukudwa khona nasemapaki la uvele uhambe nje nigcwale nje epaki, kungekho i-control, avaliwe lawo mapaki kanjalo. Siyacela ukuthi imithetho leyo igcineke. Bese kuthi kukhona umthetho omusha nje ofakiwe wasemabhange, ngoba sibonile ukuthi emabhange abantu bayahamba bayokhipha imali emshinini, kodwa akekho sanitizer. Noma ngabe ulayini mude kangakanani, bayafika nje lo achofose ahambe, nomunye achofoza ahambe, akukho ukusanitize. So sesithi sekuthiwa amabhange nawo awadlala indawo yawo yokuthi enze sure ukuthi abantu uma bezokhipha imali noma bezofaka imali baphephile, kube khona ama-sanitizer. La-ke amabhoda lawo masiphuma la eSouth Africa, lawa ophuma ngawo uhamba ngemoto noma ngamabhasi, land borders, azovalwa. Kuzoba izinto ezincane nje ezikwazi ukwenzeka lapho emabhoda, kodwa lokho uza kwethu lo phethe ezasekhaya uyena ozonaba asabalale ukuthi yini ezokwazi ukwenziwa kulawo mabhoda awu-20 azokwazi ukwenza izinto ezithize. Emisebenzini kufanele kube khona umuntu oqokiwe nje ukuthi uyena obhekelelayo zonke le zinto zezempilo, ukuthi abantu emsebenzini bayasanitizer, ukuthi abantu emsebenzini bahlala basebenza beqaqene, ukuthi bayafaka ama-mask, nayo yonke nje into efanele yenzeke. Ekwalukeni, ukwaluka akusavunyelwe. Phela laba kade sebengenile ibona kuphela okufanele bavunyelwe ukuthi baphume. Mabephuma akudingekile ukuthi kwenziwe imigidi, ngoba zonke lezo zinto yizo lezi zandisa legciwane lenza ligijime kakhulu. Ey'bhedlela nasemajele nasema-police station, zonke lezo zinto lezo ndawo akavunyelwa ukuthi kuvakashwe njengoba kunje. Indaba yokuhamba ngomgwaqo nangamabhasi namateksi umthetho wakhona awushintshanga ngaphandle ukuthi uma uhamba ibhasi esuka kude mhlawumbe esuka eKapa iya eGoli ngoba kwesinye isikhathi abezukwazi ukuthi bafike ikhefu ingakaqali bona-ke bazovumeleka ukuthi bayiqedele indlela yabo uma mhlawumbe ikhefu ifike besendaweni ethize bengakafiki la beyakhona bavumelekile ukuthi bayiqedele. Kodwa thina esihamba ngey'moto zethu siyakwazi ukuliplana kahle uhambo lwethu sihlele kahle ukuthi mangisuka la ngePulukwane mangisuka la ngeGoli mangisuka la ngiyaphi kufuneka ngifike ngesikhathi lapho-ke kufuneka bona labo bantu abanaye abaxolelwa laba abana exemption amabhasi namatekisi lawa aqhamuka kude nawo avumelekile. Bese kuthi utshwala abukavunyelwa. Sibonile ukuthi utshwala masiphuza ngoba sisuke siphuze kakhulu. Bese mase siphuze kakhulu silwe sixabane sigwazane sishayane kwesinye isikhathi uphuze kakhulu usuweqa umgaqo awusabheki imoto ikushayisa noma uphuze kakhulu usudrayiva imoto usuwenza ingozi. Konke lokile ugijime kiwe ibhedlela bakithi izibhedlela zigcwele. Uma singabuvulela utshwala baningi abantu abangaluza impilo zabo kade kungafanele ngesizathu sokuthi abasakwazi ukulapheka esibhedlela. Izibhedlela seyigcwele abantu abalimele engozini indaba yotshwala abashayene abashayiswe yimoto so abukeze uvulelwa ke bona utshwala. Yonke-ke nje lento engakavunyeleki uma uye uzenza lezi zinto ezingavunyelwa amaphoyisa azokukhuza uma ungayifakile imask uma unenkani yakubopha. Amaphoyisa azokukhuza uma ekubona wenza into engalungile kodwa uma unenkani yakubopha avumelekile manje ukuthi akubophe noma akukhokhise imali noma ungene etshele kuze kuyofika ku6 months noma kokubili. Kodwa engifuna ukugcizelela ukuthi uhulumeni akafuni ukubopha umuntu. Uhulumeni akafune umuntu nje emajele akafune umuntu akafune imali yabantu abafayinwayo. Uhulumeni into ayijahile nje ukuthi sivikelane. Ugqoka imask uvikele lo seduze kwakho nawe uzivikele. Ungabizi imigidi abantu bazohlangana noma imicimbi abantu bazohlangana bese kuthi kade kujatshuliwe ngesonto elilandelayo sekuyakhalwa sekunemncwabo. Uhulumeni uzama ukuphephisa impilo zethu zonke akaqonde kubopha umuntu. Ngakho-ke sonke masiyigcina lemithetho akekho ozoboshwa. Sonke sizophepha kodwa futhi singaboshwa. Siyacela-ke abantu bakithi ake sizame ngoba kuyafiwa manje abantu abaningi baluza impilo. Imindeni eminye iyaqotheka manje uthola ukuthi emndenini owodwa sekuhamba abantu ababili abathathu abane. Sicela nje ke sizame sonke. Miss Williams ngicabanga ukuthi ake ngime lapho sengophendula imibuzo uma ikhona. Ngiyabonga.
Siyabonga, Minister. I think at this point, Minister, can I also allow Dr. Aaron Motsoaledi to take over, and then we can take all the questions at the same time. Over to you, Minister.
Thank you very much, Phumla. Let me also greet Minister Nkosazana, Dlamini-Zuma, and thank you very much for making my work easier by explaining most of the issues that have brought us here. I am going to do two things today. Firstly, I will expand on the issues of closure of the borders, as Minister Dr. Dlamini-Zuma has already said. But I will then thereafter explain to the public the changes that Home Affairs Department has decided to institute in Home Affairs offices where services are rendered because of the COVID-19 situation, which has gotten worse. Starting with the borders, as it was said, we've closed all the 20 land borders which were open during level 1 of the lockdown. And a list of these borders is available on our website and on social media accounts. The President mentioned 6 of the busiest ones. The other 14 will be on our website and social media accounts. But as it was said, the closure will exempt certain very important services, which will include cargo and commercial goods, which will include emergency medical treatment within the country, which will include opening for diplomats, which will include deportation for people who need to be deported from South Africa, but which will also include opening for people who wish to go back home. You may remember that even during the hard lockdown early last year, when people want to go back to their homes, you cannot stop them. It will also include allowing South Africans who are in other countries who wish to come back home, because you can't force them to do so. And lastly, people who I may not have referred to, lastly, it will also include learners from our neighboring countries who attend school on everyday basis in South Africa, but sleep in their respective countries. The best example is about children from Maseru in Lesotho who attend school in various areas in the Free State. And lastly, as we have already said, if people don't fall in any of the categories I've mentioned, but they believe their case is worth considering, they will then apply to the Minister of Home Affairs for exemption, but they must give a copy of the passport, a copy of temporary residence visa, a demonstration of exceptional circumstances for requesting to enter Republic, a number of days of the intended stay, and proof of accommodation or place of residence when they are inside the country. Such applications can be sent to the following email address: COVID-19 exceptions @dha.gov.za. Let me repeat it: COVID-19 exceptions @dha.gov.za. But people who are allowed to enter the Republic are still subject to the normal COVID-19 protocols, which you all know, like the 72-hour COVID-19 certificates, isolation and quarantine. Those are still applicable. Let me then go to the Home Affairs problems in terms of service delivery. You might remember that at the beginning of the pandemic and the subsequent lockdowns, Home Affairs services were suspended in order to reduce the number of people who visit offices, to limit the risk of infection, because social distancing is always difficult when there's a large number of people. But also in terms of the public service rules, we were required that only 1% of staff must report for duty. So 1% could not serve a normal load of people. But as the lockdown levels were relaxed, we incrementally reinstated services until on the 1st of October 2020, when we went into lockdown alert level 1. This is when almost all the services were reinstated. And please underline it. I'm not saying all services, I said almost all, meaning majority of the services that we used to render before COVID-19 were reinstated on the 1st of October, but others were still not there. But unfortunately, the impact of what we did on the 1st of October had the effect of taking us back to pre-COVID-19 days, where huge crowds gather at Home Affairs offices, but while not observing any of the protocols, especially social distancing. At the beginning of December, senior managers of the department, including the minister and deputy minister, visited all 9 provinces to monitor adherence to COVID-19 protocols. They specifically visited the huge offices of Home Affairs around the country. It became clear that inside the offices, some form of protocol was adhered to, but outside it was a nightmare. Regardless of the fact that there were markings, people just ignored and never observed them. When officials and managers and inspectorate try to enforce these rules, they will momentarily observe them, but when the officials turn their back on them, they gather again in large numbers. We thought this situation will improve with time as people get used to protocols on COVID-19. Unfortunately, the situation of not observing protocols, especially social distancing, got worse and worse. And it did so at the time when the speed of the spread of the new variant was accelerating much faster than it did during the first phase of the pandemic. Now, our statistics in Home Affairs from the 1st of January 2021 to date, that means in the past 12 days, are quite alarming. Out of the 412 offices of Home Affairs, 266 had to close at some point of the other since the lockdown began in March 2020 because staff members tested positive for COVID-19. Some offices were even closed more than once. This led to a situation where out of the 5,734 employees which are employed in the civic branch, the civic branch is exactly where you get services, ID, passports, marriage, etc. Out of these 5,734 employees, 4,502 were affected in one way or the other. Either they were infected or they were contacts of those who were infected, or they came from families where somebody was actually infected. Now, between March and December 2020, a total of 532 staff members in the civic branch got COVID positive, and it's mostly from Gauteng, Eastern Cape, Western Cape, and KwaZulu-Natal. But in the first 8 days of January, the first 8 days, we already had 116 staff members who tested positive, and mostly from the very same province I've mentioned. And each time a staff member tests positive, the people who got in contact with that staff member, including clients, members of the public, we have to start tracing them. And the office must be closed for decontamination. And another shift resumes after this office has been disinfected. And then we start the cycle all over again. Now, in the first 10 days of this year, we have already lost 7 front office employees. Now, you can realize that all this is happening when the issuing of death certificates has increased exponentially in the month of December. All indications are that this month of January, at the end of this month of January rather, we'll have had even more death registration than we even have in December 2020. And if we are to compare, in December 2018, the department registered 36,826 deaths. I'm talking about death registration, not necessarily from COVID. The total number of people in South Africa who died and were issued with death certificates in 2018, in December, the month of December only, there were 36,825. In the month of December 2019, there were 38,620. In the month of December 2020, it was 55,676. This is almost more than 1.5 times what was registered in the previous 2 years. 55,676 people were issued with death certificates in December 2020. But on the 4th and the 5th of January, that means just the first 2 working days of this year, Home Affairs has already registered 10,582 deaths. So if these trends and numbers, these trends and numbers are going upwards, suggesting that there is even going to be a greater demand of death certificates than there is already. There is a greater demand now, but we believe it's going to get worse. So taking all these factors into consideration, the Department of Home Affairs has decided to temporarily suspend certain activities and certain services. This is very unfortunate, but we are forced by circumstances. And in choosing which services to suspend temporarily, we're guided by some form of statistics that of all the people who visit Home Affairs Department daily, 29% are people who visit to come and collect smart IDs. 16% apply to get, come to apply afresh for smart IDs. 11% come for the issuing of birth, marriage, or death certificates. And 10% come to apply for temporary identification documents. So guided by these statistics, we have decided that the following services will have to be suspended temporarily until further notice. Application for smart IDs, except for matriculants. We will not entertain an application for a smart ID except if you are a matriculant. Application for passports, except for people who fall in the categories that are permitted to travel in the amended disaster management regulations. We are also suspending marriage services and solemnization of marriages and registration of marriages. We are aware that this will be difficult on people, but please bear with us because we have to save lives. And for collection of IDs, please don't come to Home Affairs offices to collect an ID unless you are specifically invited via an SMS. And I'm repeating, if you did not receive an SMS from Home Affairs that you can visit the office to collect your ID, please don't come because that ID won't be issued to you. We are trying our best to reduce the numbers, but we have also decided to change some of the modalities in which Home Affairs offices, Home Affairs services are provided. We are proposing that all births and deaths be registered at the health facilities where they took place. You are aware that people do die in hospitals and relatives or funeral house, mortuaries and funeral parlors come to Home Affairs offices to collect the death certificate. We are asking that that death certificate be collected at the hospital where the death took place. And these are the hospitals which have got the presence of Home Affairs. I want to repeat, not all hospitals have got Home Affairs offices, unfortunately, but there is quite a number of hospitals where there are Home Affairs offices, where you can register a birth and a death. And a list of these offices is available on our website, www.dha.gov.za. I'm reading again, www.dha.gov.za. Also available on our Twitter account at Home Affairs SA, and our Facebook account. Mobile units will also try to assist where offices are closed or where there's a need for collection of the death registration. All our Home Affairs offices will have identified and designated counters for death registration. Home Affairs offices will continue to operate from Monday to Friday from 8 hours in the morning to 15 hours 30 in the afternoon, as we've been doing. But we are extending our operating hours to 19 hours or 7 o'clock p.m. to accommodate people who need to register deaths and birth. I repeat, we are going to extend our operating hours from now up to the 15th of February 2021. We will extend our operating hours up to 19 hours, but the services which will be offered during the extended hours are specifically registration of birth and registration of death. We are doing so to give funeral homes the capacity to come and collect death certificates so that people can be buried within the requisite period of 72 hours of 3 days, yes. In order to defeat this pandemic and go back to normality, we still appeal to everyone visiting Home Affairs offices to observe COVID-19 protocols, such as wearing masks properly, observing social distancing, and sanitizing hands regularly. Nobody will be allowed to enter any Home Affairs office without a mask. But I must add, like the President did, we have seen a massive improvement on the wearing of masks. Our biggest enemy is social distancing, which we think we have really failed to insist on people, because they do it momentarily and the next moment they forget about it. Ladies and gentlemen, let me stop there and I'll take questions. Thank you very much.
Thank you very much, Minister. I think at this point we'll try and take questions. Nongceba, do we have any questions for the ministers?
Yes, DG, we have a couple of questions. The first question is from Brian Sokoto from The Citizen. He's asking, what is your response to critics that say the prolonging of the state of disaster without parliamentary oversight is authoritarian? That is directed to the Minister of Cooperative. Nazir from Glow TV is asking, can you explain about the 50 people allowed at funerals? Is this for outdoor open air attendance at the graveyard, or are mourners allowed to gather in a tent or marquee at the graveyard, or even in the church for prayers, or at the home of the deceased? And then there is a question from the same person directed to the Minister of Home Affairs. When people are caught for illegally crossing our borders, is there an investigation as to how and where they crossed, and what measures are taken to ensure that the breach is rectified so that others don't cross through the same way again? Brian Sokoto from The Citizen again is requesting for comment on a Centurion father who was arrested for buying milk at night for a newborn baby, and he's asking whether that was not too harsh. The fourth question is from Jan Joubert from Marula Media. What is the cost of the 1.5 million dosages of vaccine ordered from India, and how will the fiscus pay for it? And I'll just read the fifth question and stop there for now, DG. That's from Christian Duplessis from Netwerk 24 to the Minister of Cooperative. Do you feel that government let the country down with the acquisition of vaccines? Thank you, DG.
Thank you very much. Minister Dr. Nkosazana Dlamini-Zuma.
Thank you for the questions. Let me first say that the extension of the national state of disaster is done according to the law, and that law was passed by Parliament. So there is nothing that we are doing which is authoritarian. We are following the law that was passed by our very same Parliament. Secondly, the 50 people maximum is any gathering around the funeral. There shouldn't be more than 50 people at the service. There shouldn't be more than 50 people at the graveyard, at the cemetery, or at the crematorium, or wherever people are gathering around the funeral. At the deceased home, we actually don't expect 50 people. We expect less. So the 50 people is just about the maximum of people that should gather around a funeral, whether it's indoors or outdoors. The price of the doses of vaccine from India, I'm sorry, I do not have that answer. I think the Minister of Health would be very capable to answer that question. Questions around the vaccine, I think the Minister of Health would be able to answer them. I'm not sure what we mean that the government has let people down around the vaccine, because I thought there was an explanation by the Minister of Health, by the President, that the vaccines will be coming. Obviously, the vaccine across the globe is not enough for everyone at the same time. So even in South Africa, it will be coming, but there will be prioritization of frontline workers, health workers, and so on. So that would be, I think those are the answers, the questions that were directed to me. Thank you.
Thank you, Minister. I think there is one question on the illegal crossing. Whether there's any investigation, what do we do after we have arrested people who have crossed illegally? I don't know whether it's Mr. Motsoaledi.
It's mine.
Yes.
It's mine, Pum.
Thank you, Minister.
Yes, thank you very much. The question is whether we investigate how and where people cross. Such an investigation is not necessary. We already know the army, which is responsible for the borderline and the sovereignty of the country, already know within the borderline where people cross illegally. That's why when we deployed people in December and early this year, we knew exactly where to deploy them on the borderline, and many of them were arrested there and sent back to the countries where they were. There is a belief that many people came through illegally, but a large number have been caught and returned. In Bait Bridge alone, I spent 2 days there, and over the past those 2 days, more than 500 people who were crossing illegally were caught by the army and sent back. On Thursday last week, I went to Mbuzini, on where the border of Eswatini and Mozambique and South Africa, where the borders converge. And I found the same thing, where the army is getting people who cross illegally and arresting them and sending them back. But secondly, the fact that Parliament over the past 10 years were coupling together a Border Management Authority Act to establish a Border Management Authority whose job is to, on a full-time basis, take care of the borders, is because there was already identification of what is happening at the borders. Now, because the bill has been passed, assented into operation by the President in July, and in December, the President signed proclamation, we were able to appoint an acting commissioner for border management who started on the 1st of January. We are preparing a presidential minute, which the President will sign, and then the job of the commissioner and deputy commissioner of the Border Management Authority will be advertised and will fill those posts. The Border Management Authority will work on the basis, on a full-time basis, other than now where we say in December and January, this area is very busy, send more people. We'll have people who do that permanently. In terms of the Border Management Authority Act, we have got to hire border guards who, in the same way as police fight crime every day, the border guards will be fighting illegal crossings into South Africa, so that the police will be relieved to do their crime prevention duties, and the army will also be relieved just to do the protection of the sovereignty of the country, not to be catching people who are just crossing illegally, sometimes with babies at their backs, and to look for a job or to buy bread and all that, and all the issues that cause people to cross illegally around the borders. That's what we're doing. Lastly, I need to mention this because I had people commenting about this morning. We have got communities around the borders who straddle borders. Remember, we are sovereign countries, but some of these borders are arbitrary. In some of them, there's not even a natural barrier between the borders. So we've got communities in areas around SADC where they straddle across borders. The same community under one chief or under one traditional leader. One is on this side of the border, the other is on the other side of the border. And you can't expect them not to visit each other or to cross. So we have got a program which unfortunately was disturbed by COVID, where such communities are given a special dispensation that they can wake up from this side to the other side of the border without producing a passport or any other document because they live within the same communities. We have only done this with a community between South Africa and Botswana. Unfortunately, I forgot the name, I don't have it now, of the communities where we are doing so. We have identified many of them where we will actually implement that. But unfortunately, the year of implementation of that was last year, and COVID-19 intervened. Will still continue in that regard. Thank you very much.
Thank you very much, Minister. I will take the last round if there are any questions, Nongaba. Do we have any last questions before we close?
Yes, we do have a couple. The first is from Elena from Ivaro Vision News. It's directed to the Minister of Cooperative. Does no access to beaches mean no access to the water as well? Or is canoeing, diving, surfing, swimming of single individuals allowed without lingering on the beach? Artwell from Alliance News is asking, what sort of steps does government plan to take against banks that do not provide hand sanitizers for ATM use? Apiwa Declare from the Sunday Times is asking a related question regarding ATMs. What will be the penalties to banks who do not provide sanitizers at their ATMs? Also, since ATMs are open beyond the operating hours of banks, will it be possible for banks to have someone manning them on behalf of the banks to ensure that sanitizers are available? If not, are you suggesting that banks should close ATMs where they won't be able to avail personnel to ensure that customers are sanitized? Charlotte from EWN is asking, could you please clarify the new regulations around beaches? Does the 100-meter rule apply to the paved and fenced areas such as Durban's Boardwalk and Cape Town's Sea Point Promenade? Then there's a question from Marvin from the Cape Argus. It's directed to the Minister of Home Affairs. Minister, can you please provide an update regarding the refugee situation in both Paint City and Wingfield in Kensington? And Marvin's also asking, is the department still planning to repatriate the asylum seekers back to their countries? If yes, when will that process be completed? Then there is a question from Nelly Chonker from Natver. Why can't government give certainty to private industry regarding the current lockdown and how long it will last? Certainty is needed for planning. Can't you say when the current situation will be reviewed? There's one last question. Can I just put it in as well, since this is the last round, DG? Patrick from Fleet Watch is asking the Minister of Home Affairs, vehicles will continue to be allowed through borders. You are aware of the problems that have arisen via the different COVID tests required by the different countries. Is there any chance of getting a standard or harmonized COVID test requirement for incoming and outgoing truck drivers as part of some special SADC protocol, namely either the PCR COVID-19 certificate valid for 72 hours or the antigen test? Thank you.
Thank you very much, Nongaba. Minister Dr. Dlamini-Zuma.
Thank you very much. Let me start maybe with the last question that relates to COPTA. There's a question about certainty, about when these regulations, how long will these regulations last? You know, these regulations are not just meant for their sake. They are there because of what is happening with the infection. The infection is high. The president did say that some of these regulations will be reviewed when we have reached the peak, past the peak, and when the numbers have dropped sufficiently to allow us to remove these regulations. Now, if we were to say we'll give certainty and say on such and such a day, those regulations will no longer apply. What if the numbers of infections have not dropped sufficiently to allow that? So I think as long as we understand that these regulations are there to protect lives, they are not arbitrarily put there. They are there to protect lives. They are there because the infection in South Africa is very high. We are getting figures up to more than 20,000 a day. So that is very high, but we don't know when it will be low. When we went to level 1, the numbers went down almost up to some days, it was even less than 1,000 a day. But today we're at some days more than 20,000 a day. So it's very difficult to give certainty over something that you don't control. But what I can say is that also the law only allows us to extend the national state of disaster every month. So that's why we do it monthly, but it doesn't mean that on the 15th of February, the figures will be low. We don't know. So it will depend on what is the infection doing, what is the state of our hospitals, are they under stress, the number of people who are dying, and all those things. So it's not possible to give certainty to say by such and such a day, these regulations will be gone. The access to the beach includes access to the water. I think it's simple. It includes both, because it means that we can say, oh, if you can just quickly get to the water or quickly get out. So I think let's make it simple. We're not allowed on the beach, in the water. The president, if it said yesterday, lagoons, even on estuaries and so on. So let's just try and make it simple for everyone. The issue of the banks, of course, the banks are run by citizens like everyone. They are institutions that must follow the law like everybody else. So if they don't keep to what they are supposed to do, the penalties are there. They start from a fine. It can be a fine, it can be imprisonment up to 6 months or both. Banks are no different from other institutions, and people who manage banks must take that responsibility, like all of us who take responsibility in the industries, in the buildings, in the malls that people manage. And should ATMs close if banks can't do it? Well, I'm quite sure the banks can provide sanitizers, they can provide personnel. If not, they can even have big self-dispensers. They can have, so the banks must figure out what to do. But the thing is to protect people who go to the ATMs and draw money or put money in. That is the idea. And the banks, I'm quite sure, are ready to do what needs to be done without closing the ATMs. Thank you.
Minister Motsoaledi.
Thank you very much. I've got two questions. I mean, there are two questions directed at me. One is about the refugee situation in Pain City. I would like to remind our people that the protesters who were holed up in the Methodist Church and around the police station, I'm emphasizing that they are protesters, because definitely not all of them are refugees in the true definition of what a refugee is. But they were protesting and they were holed up in the Methodist Church and some sleeping around the police station. Were removed there in the light of the pandemic when the Disaster Management Act was enacted, because we couldn't have people on the streets or protesting in that way while there was COVID-19, and they were taken there to save them from COVID. And as long as the Disaster Management Act, regulations are still there, then they'll remain where they are. In terms of repatriation, as soon as we went down to lock level 1 on the 1st of October, the Standing Committee of Refugee Affairs and the Refugee Appeals Authority, these are the two committees that review or look at appeals of people who have applied for refugee. They visited Pain City and the other centers where they are and started processing them. And a number of them were found to be having no rights to be in South Africa. They were taken to court and the magistrate approved that they be deported. They were transported from Cape Town to Lindela in Krugersdorp, in Mogale City, in Gauteng. And then from there, they were deported back to their country. That process is still on, but time and again keeps on being disturbed by COVID-19. Now, as to the instruction or the resolution of Parliament that those who refuse to be integrated into communities.
Good evening, you're watching ENCA. This is South Africa Tonight. Welcome and great to have you with us. I'm Annie Hunting. We've just been hearing a briefing from Minister of Cooperative, Nkosazana Dlamini-Zuma, and Minister of Home Affairs, Motsoaledi, detailing the new regulations under adjusted lockdown level 3. We'll bring you some headlines, some details from that briefing. For now, let's have a look at your headlines.
Have finalized the appeal process.
More clarity on the adjusted level 3 lockdown regulations. We'll have all the analysis.
In other words, the Standing Committee on Refugee Affairs.
Gauteng hospitals are near full capacity, as Premier David Makuda says. The number of COVID-19 admissions are surging.
And so you have got no reason to be in the country.
The Zondo Commission warns Jacob Zuma to appear before it next week, despite the pending Constitutional Court decision. Law expert Michael Osborne weighs in a little bit later.
Right from the beginning of the pandemic,
all gatherings, be they social, political or religious, are banned. Cooperative Governance and Traditional Affairs Minister Nkosazana Dlamini-Zuma says only those that were already in the regulations will be allowed. She briefed the media this afternoon.
Seeing that
the new previous regulation said that the gatherings
issued regulations on the 3rd of December for truck drivers to be tested. But when we realized there was a problem,
social
remember that the Director General of
other gatherings like
appeared on national TV and said we are now exempting truck drivers. That situation still stands. The situation at Libombo, where trucks lined for about 25 kilometers, was because the Mozambican government was retaliating. I had a meeting with the Minister of Home Affairs of Mozambique on Friday last week, where he said South Africa is not taking their COVID-19, it's not accepting rather their COVID-19 certificates, and they are retaliating by also not taking ours. We agree that that tit-for-tat situation is not helping either country, and we agree that let's exempt truck drivers from this process, and that's why you see the congestion as these truck drivers has gone through. And we are no longer
Zuma says financial
problem.
institutions must provide
in Botswana,
sanitizers
they are
at
applying
ATMs.
different rules When a truck driver appears there and is from South Africa, they don't accept any COVID-19 certificate. They test them from the beginning. They do a PCR test and wait for the results. So that truck must park there for 3 days waiting for results. That's why many truck drivers diverted their trucks from the regulation now to Beitbridge, and that's why Beitbridge was congested, because it had more trucks than it usually had, because they could no longer go through. But for the moment, in most of the borders, the truck drivers have been exempted and work is flowing very well. Thank you very much.
The ATMs could become super spreaders.
Thank you very much, Ministers. We have come to the end of this media briefing, and maybe let me use the opportunity to thank the broadcasters, and the briefing is adjourned. Thanks, Nongaba.
Problem.
While the President says we're in this lockdown together, restaurant owners say they're feeling the pinch alone. With adjusted level 3 of the lockdown now extended, alcohol sales, public gatherings and sports events remain banned. ENCA's senior reporter Aviwe Mtila visited embattled restaurants, liquor outlets and churches to get some reaction.
No alcohol at bars, a sight that's become familiar across many restaurants under the current lockdown regulations. The ripple effect of this has left many of these restaurants empty, as the owners say that a lot of their patrons come to indulge in alcoholic beverages as well.
Bye-bye.
We're sitting in a situation without alcohol being sold. Restaurants trade at about 20 to 30% of their actual potential. We're supposed to be in this together, but there is no together in the situation. We are asked to pay the ultimate sacrifice, which is on the verge of losing our businesses, if not losing our businesses.
I call it a seesaw, sort of like a merry-go-round, and it becomes difficult for a business person when you can't even project the next 7 days, and any business needs to project at least the minimum of 5 years to sustain itself. So we're in a situation where 24 hours, you don't know what's going to happen tomorrow.
Church leaders say they're also feeling the pinch.
When we have a situation where people are unable to gather in one room, you can imagine it drastically affects the income of the church. And obviously we have expenses, we have things that needs to be done in and around the church. There's maintenance costs, there's staff members that work at the church. And so it drastically influences the income, which then also puts people's lives at stake, people's livelihood at stake, people's jobs are at risk.
The general sentiment is that government should put a balance between saving lives as well as saving livelihoods. Aviwe Mtila, Tembisa, Johannesburg.
Gauteng Premier David Makhura says the province expects infections to shoot through the roof. With more than 50,000 active cases, the province is now in the eye of the coronavirus storm. Earlier, the province's Coronavirus Command Council gave an update on plans for the latest surge. ENCA reporter Masego Ratlaga has that story and joins me live. Masego, let's start with the provincial government and what they will do about contracts of healthcare workers that end on the 31st of March.
Well, Anli, you might remember that on the 31st of December 2020, that photograph from the trauma unit at the Chris Hani Baragwanath Hospital in Soweto, making the rounds of social media after the hospital tweeted that for the first time since the facility's establishment, they didn't have any trauma patients in the unit. So I asked the question about whether or not there is a budget for trauma here in the province, in the health department, and whether that budget will probably be reprioritized to go to some other aspects of the fight against the coronavirus. So the answer from the MEC as well as the Premier was that they are re-looking at the budget to see which money they can take and